how would you specifically address the problem of health care using free market principles? And we'll start off with Dan Vasella.
Oh, thank you. So, I think everyone's going to agree today that we should scrap the bills that are before Congress and start again on health care reform. What should health care reform be about? It shouldn't be focusing on the symptom, but actually focusing on the disease. The symptom is we have uninsured folks out there. The disease is that we have rampant health care inflation, and we actually need to lower costs. How many people here have seen your health care costs go down in the last 10 years? Not too many. All of us who have health insurance are hurting. And so what do we need to do to get health care costs down? Well, there are a couple things. First, we need interstate competition between insurance companies. We basically allowed insurance companies to have all these little oligopolies, and it's a giveaway to them. They should all need to compete with each other. That will lower costs. We need things like tort reform that we would all agree, capping non-economic damages at $250,000 and setting up special courts with experts who can separate frivolous claims from those that are serious. Things like preventative medicine, where we should allow insurance companies to give people lower rates if they actually go and get the testing that will prevent heart disease and cancer and diabetes and all the things that actually cost the system money. Very simple common sense things, like we spend over $100 billion a year on people who get infections in hospitals and go back in for treatment. Now these aren't Republican or Democratic issues. These are common sense ideas. And I think if we're going to do health care reform right, we need to come together and not do the partisanship and the ideological things that Obama and Pelosi and Himes have done, because we all know what they really want. They want government-run health care. What we need is a more rational, common-sense approach to lower costs for the middle class, which will also allow us to cover more of the uninsured without a $1 trillion tax increase.
You know, I've actually had a little bit of experience in systems with socialized medicine. I tore my knee pretty badly while I was living in the UK. You know what they told me? Oh, that's terrible. Can you make it to class? Because I was a student. I said, yeah, I can make it there, but it really hurts, and it takes me a while to get there. They said, okay, that's great, though. It means that your role in society is being fulfilled. So we're going to put you on our secondary list. By the time I would have received the necessary surgery to get my knee fixed, a year would have passed. A year. That is unacceptable. We cannot, in the United States, afford to adopt such systems. Now, this bill that the Democrats tried to ram through Congress and appears to be gridlocked right now because of the recent election in Massachusetts, it's not about driving down costs. It's not about enhancing the quality or access to health care. It's about consolidating power and decision-making in Washington. What we need to do are just common sense solutions that we can implement quickly so long as there's the adequate political will. Tort reform. We need to ensure that our doctors are practicing defensive medicine. And also, there's a critical aspect to this that I haven't heard many people at all talk about. Doctors used to go out there and provide pro bono care. You know, they would set aside a day a week where they would provide their skills and assistance to those who weren't as fortunate as a lot of their normal patients. Why did they stop doing it? Well, a big driver in that was the fact that malpractice insurance went through the roof. They couldn't afford to give that health care. We need to make sure that we resolve this immediately, and we also need to encourage them to do that. Let's give them an hourly tax credit for providing care to those who don't have as many resources as many of us in this room are fortunate enough to have. Now, there are a lot of other things we need to do to drive down costs, and I was just given the notice, so I can't get into all of them now, but I'm happy to talk with you afterwards as well to address all of them. I'm just expiring.
First thing we have to do is remind the federal government of its role. Nowhere in the Constitution does it justify the federal government creating a one-size-fits-all health care plan for the entire nation. Never mind the fact. How could Congress create a good health care plan that works as well in Connecticut as it does in Texas, or Washington State, or Pennsylvania? This is the business of the states. And frankly, those of us that live here in Connecticut should be proud of the fact that 94% of the people in Connecticut have health care, and that Governor Rell has shepherded the Charter Oak Plan to address the other 6% that don't have health care. There is a role Congress can play, but it should be limited to the interstate commerce aspect of health care. We need to encourage portability so that you can take your health care with you and you don't lose it when you transfer jobs. We need to encourage competition. I had to buy a new health care plan about a year ago, and I was shocked when I found I only had about 6 options in Connecticut, when there are thousands of health care companies in the United States. We want health care to be more affordable. We have to encourage competition. And we have to get the out-of-control medical malpractice lawsuits under control. And frankly, we need a debate about this. We're not seeing that. The Democrats want to debate health care in the middle of the night on a Saturday. And frankly, the Republicans' response has pretty much just been to scream and yell. Where's the debate? We've heard wonderful solutions. We need to hear those out publicly. I'd like to hear from not only our Republican leaders, but also our Democrat leaders, how we can actually fix this. This is a big deal that affects all of us. And we're just not getting the sort of response out of Washington we need.
This health care bill is not about health care, it's about power. It's about taking power from the people and giving it to the government. Whatever crisis there is out there, it's actually mostly all government created to begin with. So it's kind of ludicrous to start a discussion about how to improve health care when in fact health care has been devastated by government's role in it already. I asked Jim Himes a question in Bridgeport. He came in to talk about health care, and my simple question was, why don't you guys work on getting Social Security, Medicare, and Medicaid correct first, demonstrate your abilities in those areas, and then come to us and tell us that you can do it? It was kind of a rhetorical question. Jim Himes responded to me by saying that if Rick Torres thinks that he is going to support eliminating Social Security, Medicare, Medicaid, he's crazy. Well, I never said that. That wasn't the point, and he diverted nicely, though. The point is government can't do things well. The last thing that any one of us would ever think to ourselves when we want to get something done well, as I said before, is to call government. That's the last thing we would do. Oh, let's see. So the solution ultimately is to apply the principles of the free market to health care, try to eliminate the middleman, which is the insurance company, from our doctors so that we can negotiate with our doctors correctly. If we had a system where we could stash our money away in the bank in a certain way, which President Bush suggested, then we could engage the doctors directly and negotiate our own prices with doctors. That would lower the cost.
I agree with all the bells and whistles, cross-border competition, portability, tort reform. And let's talk about what that really means. I've seen studies that say 30% of procedures done on patients, which are by definition invasive. If you have a scan or a biopsy or an x-ray, that does something to you, the patient. Drugs and additional treatment, just in case. These are all done to protect doctors from frivolous lawsuits. 30% of those procedures can be eliminated if we cap medical malpractice pain and suffering awards. We're not talking about the inability to sue your doctor. Some doctors should be sued, and they should be run out of medical practice. But if you cap it at $750,000, like Texas did, you'll see a situation where medical malpractice insurance premiums, which have risen 2,000% since the 70s, will drop immediately. In Texas, they dropped over 30%. And the unintended consequence was more doctors and medical facilities set up in Texas than they had ever seen. So people had lower costs, better access, and better quality, all with a free market approach. I don't think people are talking about tax equality. Businesses have the ability to write off 100% of healthcare premium for their employees. But as an individual, you don't. So what does that do? That tethers you to your company. If you have equality in tax treatment, you now have bargaining power. And you can move against the insurance companies and against the medical profession to keep costs down. Last thing I want to say is the Medicare system is broken, and it's actually foisting costs onto the private sector and the private insurance companies because they underpay for services rendered, and they force doctors to accept much less than they could otherwise be making.